Myself, Dr. Deepak Prasad J, Consultant Rehabilitation Physician at Athulya Senior Care, Bangalore. What happens to our body and the brain after a stroke and why timely rehabilitation is so crucial? There is something called neuroplasticity in brain, and after a stroke event in the acute setting, there will be neuroplasticity, which is called rewiring of the brain naturally by itself, and this will happen mostly in the first 90 days after stroke. There is something called golden period after stroke. Just like the golden hour of stroke, there is golden period of stroke, which is the initial 60 to 90 days after stroke. This is very important because there is something called neuroplasticity, which is the brain's remarkable ability to rewire itself after an injury, and this is maximum during the 60 to 90 days of stroke period. Once the patient is stable and patient is shifted out of ICU, acute rehabilitation should be started, and it should be continued till 60 to 90 days. So during this time, neuroplasticity will increase and gradually it will start to taper down after 90 days. That is the reason rehabilitation, specifically physiotherapy, occupational therapy and speech and swallow therapy, has to be started in the early stage itself. So when we speak about stroke rehabilitation, it is a multidisciplinary team approach, and this team consists of rehab physicians, physiotherapists, occupational therapists, speech and language pathologist or a speech therapist. After stroke, there are plenty of complications and sequelae which happens in the form of difficulty in swallowing, difficulty in speech, difficulty in ambulation and mobility disturbances. So each has to be addressed individually, and a rehab care plan will be made by the rehab physician and it will be given to the team, rehab team. Physiotherapist will help in mobility issues, and in initial stages, the treatment will be focusing mostly on range of motion exercises and stretching activities and DVT prevention activities to help in preventing complications. And after that, it will be progressed to ambulation training, tilt table training, and gait training and balance training. An occupational therapist will focus mainly on activities of daily living, retraining, and functional retraining. And cognitive issues also occupational therapist will address. And coming to speech and language pathologist, so they help in assessing and evaluating speech and swallowing issues. In case of a suspected aspiration, we also do endoscopic studies to confirm if there is any silent aspiration, which are often unnoticed. So when we tell about multidisciplinary team, we almost always involve the family members in the team. So what happens is, generally in elderly population, they are more prone for anxiety and depression. So after a major cerebrovascular event like a stroke, they are more prone for anxiety and depression. That's why we involve the family members to aid in the progress of the journey.